These policemen in the city of Peshawar are lucky to have protective clothing. As Pakistani health workers demand government help, police and security forces are having to focus less on fighting crime and more on stopping the spread of COVID-19.
We are providing personal protective equipment to all police officers in the field. We have also organized workshops about taking necessary precautions for their own safety and the safety of their colleagues and their families.
The streets of Peshawar in the northwest of Pakistan are virtually empty. Police use loud hailers to urge people to stay at home. Government spending on healthcare for Pakistan's 225 million people has been less than 1% of GDP in recent decades. Hospitals are often significantly ill-equipped and overcrowded at the best of times. As COVID-19 spreads, desperate attempts are being made to prepare health facilities to cope with the rising number of infected people.
Health professionals are the frontline force against COVID-19, but unfortunately we are going to fight this battle without any protective gear. It's of the utmost importance for us as arms and ammunition for military when they are going to a battlefield, and it would be considered as suicide if we fight without proper kits.
Dr. Osama Riaz was the first doctor in Pakistan to be killed by the virus. He'd been treating COVID-19 victims, many who had arrived from neighbouring Iran, which has been one of the worst hit countries. It's not known how many health workers have been infected across Pakistan. Many with symptoms are in quarantine or self-isolating.
The government is least concerned about the safety of nurses, their well-being or even duty hours. They play a vital role in healthcare, and sadly there's one nurse for 99 patients on normal days, and if the situation gets out of control, how are they going to cope? So they must hire more nurses to tackle this crisis.
China has sent medical equipment across the border. The help is vital, but nowhere near enough. At this hospital, police gave a guard of honour to show respect to staff and to try and boost morale. But for the medics here and at hospitals across Pakistan, it will take more than ceremony to save lives. Charles Stratford, Al Jazeera.